All right. Hello, everyone. Thank you for tuning in to another YouTube video. It is Monday night. It is 10:10 right now, so I definitely please forgive me for not having this video uploaded yesterday, Sunday, when I have it uploaded. So there's a few more housekeeping that I want to do. Call of action is that if you like this video, make sure that you click the thumb button, subscribe to the channel, and share it with all your friends and family, co-workers, neighbors, anyone that you know that is thinking about surgery, already has surgery, or hey, they just want to live a better life. They want to really enhance their wellness, their health and wellness in their body, in their mind, in their spirit. And so deep breathing is definitely one of those things that is not just for after surgery, before surgery. It's just good to do in our everyday life. I definitely implement it into my wellness lifestyle of making sure that I am getting the maximum oxygen, increasing my oxygen capacity in my lungs, throughout my body, to where my skin and my hair, my eyes, everything is looking at its best. So let's get on to these 10 reasons why deep breathing is beneficial after surgery. Because our mission statement is aftercare matters the most. So number one, deep breathing removes the mucus drainage that develops into pneumonia. Um, Many of you all know when you had surgery, the anesthesia put you to sleep. So, with that, when you are having anesthesia, it is all throughout your body and it rests many times in the lungs. So, when you are of out of being sleep and you or have awoken from surgery, um, it is best to start deep breathing, doing slow, deep breaths to start removing the mucus that that's loaded up in your lungs from the anesthesia, because it definitely will prevent you from for it developing into pneumonia, which we do not want, especially after surgery. And another reason with that is that your body, the core body temperature changes because anesthesia actually lowers the body temperature. So that's why it's so important that we pre warm our bodies before surgery and we keep it at the core body temperature, which is ranged between 96, I would say 96.6 to 95.6. They want to say that is the normal core body temperature. So that plays a huge role in pre-warming the body and also um, warming up the body, keeping the body at a good warm temp while it's on the table as much as possible. But the anesthesia it will lower the body temperature. So many times is when you wake up, you're feeling cold because the anesthesia actually lowers your core body temperature. So that's why you'll see them with those machines. It's pump up to like a foil type of material blanket because they are warming up they're trying to heighten or increase the core body temperature because that helps with wound healing. That helps with also with for you not to develop any type of pneumonia. Um, so it's so many different moving parts. So definitely deep breathing is definitely important. I may have to definitely do a video about um, the importance of maintaining a normal or optimal core body temperature before and after surgery, because that's something that definitely needs to be spoken about. Just to give you some tips on things that you want to do preparing your body before surgery while you're at home. So number two is that deep breathing. This piggyback off step. Reason number one is that anesthesia, um, it definitely clouds the mind mentally, and it also physically it clouds the lungs. So deep breathing exercises, slow deep breathing through the nose, out the mouth, very slowly. It helps with wearing off the anesthesia. So then you start feeling like, okay, I am truly in a balanced state. My mind is clear for me to make decisions. That's why they tell you all, do not make any decisions um, 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 within the first 24 or 48 hours, because you are going to still have some lack of anesthesia. Some people, it's definitely 48 to 72 hours. For some people 24 hours, they are out. They have completely have wore off the anesthesia, so they're good to go. So it's so important to implement slow deep breathings in your regimens of healing your body, healing your mind, healing your emotions, because it is so important in wearing off the anesthesia. It is not something that you want to let it lag. You want to quickly get it wore off as quickly as possible. Number three, deep breathing assists with post optimal pain. Um, um, the reason why deep breathing helps with post optimal pain, with reducing it, is because it relaxes the tight muscles and organs in the body following the surgery. Um, Many times your body is producing a lot of cortisol, which is produced from stress hormones. Your body is in shock, so so um, so it's in that systematic um, rhythm where it's at its heightened fight or flight. It just went through trauma, and it's still trying to find its way back to balance, but it's in this heightened state. So when we're stressed, what hormone is being released? Cortisol. So that's why it's so important to make sure that you are um, practicing slow, deep breathings after you come out of surgery when you wake up. Because it helps with loosening your muscles, your joints, your organs in your body. It start relaxing them and getting it into a calm state. Um, Reason number four, deep breathing encourage coughing. Coughing definitely piggybacks off of reason number one. It's with the mucus that develops from the anesthesia that resting in the lungs. So coughing helps a lot with getting that phlegm, all that residue of the anesthesia, which have turned into mucus, out of your lungs. Um, and deep breathing helps with getting the initiates the coughing to get rid of the mucus out of your lungs. Now remember, deep breathing is slow. Efficient deep breathing is slow breaths, so it's not fast. Because if you do it fast, you may actually make yourself become nauseated. You may become dizzy. So everything needs to be a very slow and steady breaths, very slow. So we may do some practice after I get done with the 10 reasons, just so you can have a visual of what exactly, um, how how slow deep breaths are supposed to be. Reason number five, um, deep breaths or deep breathing stimulates the cleansing, or we would say the flow of the lymphatic system, regulating it to where it's helping to move the lymph flow throughout the body. Because you know that we have lymph nodes in our in our zitterary area. We have them in our groin. We also have them in our neck area. So those areas you want to make sure that you are utilizing the slow breaths in helping to activate the lymph to start flowing through the body, because the body really comes to a halt, or I won't say a halt, but at a very more slow motion when the body has been put underneath anesthesia. You're on the operation table. Everything is just kind of feeding on each other just to keep everything functioning, but it's done in a more of a slower type of state. So the body is trying to regulate itself back to its constant flow of 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 circulation, of functionality. Um, and reason number six is deep breaths helps with increasing blood circulation, and that's one of the main reasons, one of the more well-known reasons for deep breath that people know about, because the benefits of blood circulation is spectacular, because it helps with the glow of our skin complexion. It helps um, with where we have a glow. It helps with our eyes, where our eyes are more clear. Um, it helps with also with helping with our surgical wounds to heal a lot faster, because the blood circulation is moving at a faster pace with more oxygen that is fed into the blood. That's going to help with helping with wounds to heal a lot faster. It's going to help with the skin to um, contract, to come closer together, to where um, it reduces the chances of having scars, um, because scars come from um, having too much of um, God, I forgot that fast. It's like the red tissues, and I can't even think of it right now. But it helps with it helps with reducing scar formation when you have a higher level of blood circulation, because there's more oxygen that is flowing in the blood by implementing slow, deep breaths throughout the day. If you can do it, if you can do it for 15 to 20 minutes every hour, that would be really, really good, because you are implementing more oxygen to come into the body, which is going to remove all the debris. It's going to bring in more health. It's going to bring in your skin is going to look better. And then also too is that you you'll just be healing a lot faster, safer, and healthier way. Reason number seven is deep breaths reduce blood pressure. So um, many times when you come out of surgery, your blood pressure is elevated because you have just gone through a state of shock. Your body just went through a traumatic injury. So your body is trying to find its way back to balance, finding its way back from fighting, from the fight or flight. So when you implement deep breaths into your healing process, in your wellness healing process, I like to say, um, it definitely helps with lowering the blood pressure, which help with the blood vessels with dilating, not contract, not being constricted, but dilating. And also it helps with the tissues and the organs to relax, because everything is responding when our blood pressure is up because our body is in shock. So when you start implementing the slow breaths every hour, between about 10 to 15, maybe, or if you can do 20 minutes of slow breaths, of deep breathe, that's going to help with lowering um, the stress hormones, and it's going to take it from systematic um, um, flow to more of a parasympathetic function. So, and that is the key thing that you want is really calming down your body from having surgery when it has surgery. Um, Reason number 8, and this is one that I didn't know about, is that slow, deep breaths help with increasing digestion. Um, the diaphragm of our on the top of our stomach is a muscle. So the more that we are working that diaphragm, it's actually helping to relax the bodily organs, and also is helping the stomach to reduce the chances of or reducing issues of constipation. It can subside any abdominal cramps. It can subside any bloating that may have happened. Um, so it definitely has great benefits that I didn't even know about, and that also helps with whatever that you're eating after surgery. With deep breaths, slow deep breaths, it helps with your digestion. Now I will say this: it's great to do the slow deep breaths on an empty stomach, and then eat, and then you'll wait for about an hour, and then you can start back doing the slow deep breaths again. But I wouldn't do the slow deep breaths right after having something to eat, because it may actually promote nauseating or vomiting. So you want to space out that time of when you are practicing or practicing slow breaths. So do it on an empty stomach. So like in the morning when you wake up, you want to go ahead and start doing your deep breaths, slow deep breaths in the morning before you eat. Then after you eat, then you'll wait about an hour, and then you will do your slow breaths again, at least an hour. You may have to wait a little longer, just depending on what you're eating. Hopefully that you're eating something that's light and nutritious during the time of your healing after your surgery, because we want to get the optimal level of healing after surgery. So we don't want the baseline. We want to increase um, our improvement um, of healing after surgery, to where it's almost as if we don't even have any evidence that we had surgery. Reason number 9 is increasing calmness. Um, Deep breaths by itself, when you're lying down or you sitting in a chair, if you just close your eyes and just deep breaths, slow deep breaths, it calms the brain, it calms your mood, it calms your emotions, to where you're able to relax the body into a state of balance, in a state of where it has a chance to position from a state of shock to a state of healing. Um, and the last one, reason number 10, deep breaths increase immunity in our bodies. And what I mean by immunity means our immune system. Um, and that's another one that I was not aware of, that deep breaths, slow deep breaths, with the increased oxygen that flows in, that is coming into the body. With the oxygen, it also works as a repeller against bacteria, viruses that comes into the body to harm. So if we are implementing deep breaths into our wellness lifestyle, on a daily basis, especially after surgery, is that it is going to help us to where it's going to improve our immunity during the times when we are most vulnerable after surgery. We have wounds, we have JP drains, where we our body core temperature is fluctuating back and forth. So during this time, you want to make sure that you are implementing in slow, deep breaths, because there's so many benefits. There's so many benefits of deep breaths after surgery, because your core body temperature is fluctuating. It's fluctuating. Is trying to find its new medium, um, because your body has a surgical injury. So right now, I would just want to just do a few rounds of slow, deep breath for you all to see how it's done. And this is what I do with my own patients, is that I have them to sit down, or if they're laying on a bed, and I have them to close their eyes, and I have them to lay their hands by their side, and whatever position that they're in, what for example, let's say if they had a BBL, or if they had a tummy tuck, so they will be positioned in a way to where it's not going to hurt the surgery that they had done, but it's also going to be in a position to where they can do the deep breaths, where it will relax them. And so in whatever position that I'll have them in, I'll have them where they close their eyes and have their hands by their side or on their legs, and I'll say, well, close your eyes. And the first thing that we're going to do is we're going to inhale in through the nose, and then exhale out the mouth. And when you're doing that, you're inhaling slowly and you're exhaling slowly, because you want to give the oxygen time to go throughout your entire body. You do not want the oxygen to be where it's feeling like it's being cut off from not reaching the entire body. So we're going to do it again. We're going to close our eyes, and we're going to inhale through our nose. Okay, all the way in, and we're going to hold it, and then we're going to exhale out our mouth. Then we're going to do it again. Inhale through the nose, and then exhale out the mouth slowly. And so you would do that for about 10 to 15 minutes, or if you can do it for about 20 minutes. It makes such a big difference in your physical body, mentally, and emotionally. So I hope that you all enjoyed this video tonight. I try to make my videos not too long, because I know people attention spans are not very long, but I wanted to make it long enough to where I am explaining the importance of implementing these naturopathic approaches to a healthier, safer, faster way of healing your body and getting your body into a state of balance. Um, and definitely do this. Do this every day. Make sure that you're doing this, and make sure that it doesn't have to be perfect, but when you start practicing doing adequate deep breaths, you're going to experience you're going to experience a different level of wellness and health in your body. You're going to see a difference in your blood pressure. You're going to see a difference in your body. You're going to feel a difference with 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 your joints. You're going to feel a difference in your mind, in your brain, to where that you're able to think more clearly. So I hope you all enjoyed this video tonight. I'll definitely be back next Sunday with another video. So I think that maybe the next one that I do is that I'm going to talk about the importance and what to do and how to pre-warm your body and keep your body at the core body temperature before surgery and after surgery when you're back home, because it plays such a vital role in how your surgical wounds heal. Because if not, it could lead to complications and chronic wounds. And it also interferes with our pH in our wombs. So it's definitely something that I definitely will dive more deeper in the next video. So I hope you all enjoyed this video. Again, click the thumb button if you like it. Subscribe to the Post Surgery Care of Atlanta YouTube channel. Share it to all your friends. And if you would like a virtual consultation, definitely go to the website www.postsurgeryatlanta.org, and you will see the icon where it says make an appointment, and you'll go there and you'll click on virtual consultation, and you will speak with me, the care practitioner, and we'll take it from there. And I hope you all have a blessed night. Bye.